Minister, you and I are going to go for a drive. This morning, the government announced it's taking action on health care for Albertans.
Order.
Interesting timing.
Order.
Emergency rooms in Edmonton and Calgary will be renovated at a cost of $50 million over 2 years. But here's the catch. Apparently, it's all depending on detailed planning. Now, this sounds oddly familiar to the government's school strategy. Make an announcement, put up a sign, and walk away. Minister, Albertans are tired of empty pre-election promises. If you haven't done the detailed planning, how can you possibly announce it?
Thank you. Honourable Minister.
Thank you, Mr. Speaker. We're moving ahead as quickly as possible on these plans. You can fast-track with creative people in order to get things done in a very expeditious way. We plan to move through our redevelopment of our emergency rooms because they're needed, and they'll be done in a reasonable length of time because this government wants to see projects move ahead quickly.
For supplemental, honourable member.
Well, Minister, whatever you do, don't get the infrastructure minister because he doesn't move very fast. Minister, you claim to be taking action, yet the transition beds you announced today won't even be built till next fall. We've seen how this government's promise evolved over the span of just 1 week, let alone half a year. Albertans aren't by it. So, last week, an entire surgical ward was closed at the Peter Lougheed, and nurses were laid off. The spin of this, of course, was that the beds were being converted into transition units for seniors. Good news. But if you're waiting for surgery, well, I guess that's too bad. Where are the 36 surgical beds going to be?
Simple question. Honourable Minister of Health.
Mr. Speaker, this government is committed to maintaining their promises. Last fall, we committed to 750 beds, 750 new long-term care beds, of which 466 would be available this year, and we will have 303. As to the surgical beds, Peter Lougheed is in a position to deliver those services, but they're using some of the facilities for restorative care, which is a really important part of making sure our citizens are taken care of.
We didn't get where the surgical beds are, so let's try this. It seems like only a few weeks ago the Premier stood up and he pronounced to Albertans that there is no more money. Zero, nothing, zilch. Now it seems on the even election the government does have money. Money for schools, money for hospitals, money for seniors' beds, money for anything and everything that Albertans need. Now we've seen this game before. You promise the world, you call an election, then you break your promise. Premier, 1 minute there's no money, the next minute there's millions. Where's the money to pay for these pre-election promises? Show us the money, Premier.
Honourable Premier.
Well, Mr. Speaker, I would encourage the honourable member to stay tuned, and she will, in due course, see a fiscal plan and a budget and a financial plan that takes this province forward. But we've been very clear, both the Minister of Finance and myself, that we will firstly maintain the quality of frontline services to Albertans, because that is what Albertans want, Mr. Speaker. We've also been very clear that we intend to get caught up and continue to build the social capital that we need in this province. That is what Albertans have expected from this government, and that's what we will deliver, Mr. Speaker.